Okay, so again, which road are we going to go down? Left hand or right hand? Left hand is original Medicare. And the importance there is you have 5 different ways you can work with supplements or not. You could have Part A and do nothing else. Part A is just the hospital. That's all the coverage you want, you could do that. Or you could do A and B. Remembering that with B, you're going to pay $135 a month to the government, either through your Social Security or by writing them a check. You then also could do A plus B plus a supplement. A through N currently. Or you could do A plus B plus D. Or, as I call the last one, the full house, you can do A plus B plus D plus a supplement. Okay? But Medicare Advantage, you're either doing Medicare Advantage, it may or may not include a drug plan. It cannot have a standalone drug plan. So if you buy a Medicare Advantage plan that does not have Part D included, you cannot buy a separate Part D plan. Okay? And you also cannot buy a supplement to go over the top of your Medicare Advantage. Medicare Advantage, remember, it's over here. It's staying away. Supplements are over here. They both are going down the road, but they're 2 different roads. Does that make sense? Questions about that?
Why would I want Medicare Advantage?
So far, I haven't given you any good reasons. I agree with you. But we'll talk about that. There are some reasons why Medicare Advantage is out there and what the government is looking for out of Medicare Advantage. But good point. So again, Medicare Advantage, you're replacing A and B. So you're actually replacing that new card with the insurance company card. So when you go to the doctor and you're on a Medicare Advantage plan, the only card you're giving at the doctor's office or the hospital is your Medicare Advantage card. Keep your Social Security or your Medicare card in your pocket. All right? They have to cover all the services that original Medicare covers. They just get to do it a little differently. They have to cover it, but you can have some co-pays, you can have some different deductibles, and that's what we're going to look at. The key to Medicare Advantage is the word may. They may include prescription drugs. They may include extra coverage for vision, hearing, dental, or anybody heard of silver sneakers? Okay? That comes from a Medicare Advantage product. They may or may not include the drug coverage. They may or may not have benefits similar to Medigap. They may or may not cost less than Medigap. So there's a difference too between cost and premium. And we're going to talk about that. What's the difference between cost and premium? They are not required to have the same deductibles and co-payments as original Medicare. Most of them are going to have deductibles and co-insurance. Most of them are going to have co-pays, but they're going to be set up differently than that slide I was showing you of Part A and B. All right? And again, they do not coordinate with a Medigap. Medigap is over here, Medicare Advantage is over here. So what types of Medicare Advantage plans are available? Most of us have been familiar with health maintenance organizations, or HMOs. That's the most restrictive program. PPO, or Preferred Provider Organization, is the next level. The key difference between those two is a PPO has out-of-network coverage, and HMO does not. So that is extremely important. That's the biggest difference between an HMO and a PPO. You also have some plans out there that are called special needs. Special needs are things like heart disease, COPD, or cancer, or kidney dialysis. If you are in that category, there are some special programs that the government has made available for you, which again is to coordinate your care and help you improve your quality of life. Private fee-for-service is pretty much going away. We're going to show you that. But the intent of the private fee-for-service years ago was it was a way to get the out-of-network coverage. It was a way to use a non-network program. There was no network. Government changed that a couple of years ago, said no, even a private fee-for-service has to have a network. So it's not much different than a PPO, and that's why it's slowly going away. How many of you have heard of a health savings account? Okay? That's pretty much what a medical savings account is, except Medicare is going to put $1,500 into the account at the beginning of the year for you. But the negative, you have $6,700 in deductible you have to meet. So that scale doesn't balance very well. Okay, so we've talked a little bit about networks, the difference between an HMO and a PPO. But let's look at the bigger picture. The bigger picture is the original Medicare plus a supplement. That is a network that is any provider, hospital, physician that has said, I will take Medicare. I will take a Medicare patient. If they agree to that, they're in the larger network, the largest network. And it crosses all states. So if you have a plan here in Illinois and you are traveling, you have emergency coverage no matter what. But if you went to Florida and stayed for a while, you could also have a doctor down there that would see you and your supplement would pay. But when you get into the private fee-for-service, you shrink that a little bit. There the doctor has to agree to take it because they could balance bill you. The next line is the PPO. PPO is, again, as long as there's a network doctor where you're at, you could use that network doctor. That's the importance of it. But the next two, HMO with a point of service and HMO, you don't have out-of-network coverage. So how many of you travel to Florida or Arizona or anything like that in the wintertime? Okay? So when you do that under a Medicare Advantage plan, you have emergency coverage only. If you're down there for 6 months and you just want to have a checkup with a doctor, you're going to pay for that out of your pocket because it's out of network. Okay? That makes some sense? Nationally, we keep hearing, you see all the ads on TV, Medicare Advantage is great. Medicare Advantage, everybody's buying it. No, not everybody is buying it, to our gentleman in the back. There are about 33% right now that buy a Medicare Advantage. They are mostly in suburban areas. So Chicago, St. Louis, Champaign, anywhere where you have enough doctors and enough hospitals to make a plan viable. Because at HMO, you have to have enough physicians to make it work. Local and regional PPOs make out another 7.2 million. And as I talked about, the private fee-for-service and the MSA, they're shrinking each year. We don't expect them to stay much longer. Medicare Advantage is growing. There's two reasons for it. One is that people are used to HMOs at their work. So when they decide to retire, they want to stay with their doctor. Their doctor's in the HMO, they stay with the HMO. The HMO is a Medicare Advantage plan. It's not original Medicare. So that's one of the reasons for growth. The other reason for growth is we have about 10,000 people a day aging to 65. That's automatically going to make a program increase because they're already used to HMOs. They're already used to PPOs. That's what they've had at work for the last 30, 40 years. But locally, Edgar County, we only have about 16, 17% that are purchasing Medicare Advantage. Champaign County, a little higher. They're actually higher than the national average. Well, we have a very strong HMO presence in Champaign.